Lumbar spinal stenosis is the narrowing of one or more levels of the lumbar spinal bony canal that subsequently closes in or compresses the nerve roots. The human spine is formed by 24 spinal bones called vertebrae that are stacked on top of one another to form the spinal column. The section of the spine in the lower back, comprised of 5 vertebral bodies, is known as the lumbar spine. Doctors often refer to these vertebrae as L1 to L5. These 5 vertebrae line up to give the low back a slight inward curve. The lowest vertebra of the lumbar spine, L5, connects to the top of the sacrum, a triangular bone at the base of the spine that fits between the 2 pelvic bones. The back portion of the spinal column forms a bony ring. When the vertebrae are stacked on top of each other, these bony rings create a hollow tube called the spinal canal. The spinal canal surrounds the spinal cord as it passes through the spine. The spinal cord only extends to the second lumbar vertebra. Below this level, the spinal canal encloses a bundle of spinal nerves that go to the lower limbs and pelvic organs. The Latin term for this bundle of nerves is cauda equina, meaning horse's tail. Intervertebral discs separate the vertebrae. The discs are made of connective tissue, which is the material that holds the living cells of the body together. Most connective tissue is made of fibers of a material called collagen. These fibers help the disc withstand tension and pressure. A disc is made of 2 parts. The center, called the nucleus, is spongy. It provides most of the disc's ability to absorb shock. The nucleus is held in place by the annulus, which is a series of strong ligament rings surrounding it. Healthy discs work like shock absorbers to cushion the spine. They protect the spine against the daily pull of gravity. They also protect it during strenuous activities that put strong force on the spine, such as jumping, running, and lifting. In the lumbar spine, the spinal canal usually has more than enough room for the spinal nerves. The canal is normally 17 to 18 millimeters in diameter. Symptoms of spinal stenosis develop when the diameter narrows to 12 millimeters or less. There are many reasons why symptoms of spinal stenosis develop. Some of the more common reasons include congenital, or being born with a small canal, aging or degenerative changes, and spinal instability and disc herniation. People who are born with stenosis may not feel problems early in life, but even a minor back injury can put pressure on the nerve roots and cause symptoms. As the canal tends to narrow just with aging, these patients are at a higher risk of having problems in later life. Degeneration is the most common cause of spinal stenosis. Wear and tear on the spine from aging and from repeated stresses and strains can cause many problems in the lumbar spine. The intervertebral disc can begin to collapse and the space between each vertebra shrinks. Bone spurs may form that stick into the spinal canal and reduce the space available to the spinal nerves. The ligaments that hold the vertebrae together may thicken and also push into the spinal canal. All of these conditions cause the spinal canal to narrow. Spinal instability can cause spinal stenosis. Spinal instability means that the bones of the spine move more than they should. Instability in the lumbar spine can develop if the supporting ligaments have been stretched or torn from a severe back injury. People with diseases that loosen their connective tissues may also have spinal instability. Whatever the cause, extra movement in the bones of the spine can lead to spinal stenosis. Spinal stenosis can occur when an intervertebral disc in the low back herniates or ruptures. Normally, the shock-absorbing disc is able to handle the downward pressure of gravity and the strain from daily activities. However, if the pressure on the disc exceeds the strength of the annulus, the disc may rupture through the outer annulus and squeeze out of the disc. This is called a disc herniation. If an intervertebral disc herniates straight backward, it can press against the nerves in the spinal canal, causing symptoms of spinal stenosis. Symptoms of spinal stenosis usually develop slowly over a long period of time. This is because the main cause of spinal stenosis is spinal degeneration in later life. A severe injury or a herniated disc may cause symptoms to develop immediately. Patients with stenosis don't always feel back pain. Primarily, they have pain and weakness in their legs, usually in both legs at the same time. Symptoms mainly affect sensation in the lower limbs. Nerve pressure from stenosis can cause a feeling of pins and needles in the skin where the spinal nerves travel. Symptoms change with the position of the low back. Flexion or bending forward widens the spinal canal and usually eases symptoms. Straightening or even bending back slightly makes the spinal canal smaller and often worsens symptoms. The diagnosis begins with a complete history and physical examination. The examination will include testing skin sensation, muscle strength, and reflexes. X-rays can show changes in the bones of the spine, and if intervertebral discs have deteriorated or collapsed. Magnetic resonance imaging, or an MRI scan, may be used to give a clear picture of the spinal canal, and whether the nerves are being compressed by bone and/or soft tissue, such as a herniated disc. Sometimes, when the diagnosis is still not clear, your doctor may order electrical tests of the nerves of the legs and feet. Your doctor may also use blood tests to determine whether symptoms are coming from other conditions, such as arthritis or infection. Initial treatment generally combines non-steroidal anti-inflammatory drugs and physical activity. Rehabilitation under the care of a physical therapist is appropriate. Water exercise and other reconditioning therapies to improve spinal strength and mobility are helpful in reducing or eliminating symptoms. Epidural steroid injections may be helpful, but are limited to 3 in a 6-month period. These can reduce swelling and give the nerves more room inside the spinal canal. Patients who are becoming non-ambulatory and report a diminished quality of life are candidates for surgical management, although sudden loss of bowel or bladder function calls for immediate surgery. The main surgical procedure used to treat spinal stenosis is lumbar laminectomy. When the nerves in the spinal canal are being compressed by a herniated disc or bone spurs, a lumbar laminectomy removes the entire lamina to release pressure on the spinal nerves. A posterior lumbar fusion may be needed after a surgeon performs a lumbar laminectomy. The fusion procedure is recommended when a spinal segment has become loose or unstable. Well, I had to swallow there. I hope that would